what happens when it's more severe? How are you covered in a health share policy?
Yeah, so ClearShare is the health share portion of the plan. So people can sign up just for ClearShare standalone. They can sign up for the holistic savings or the holistic plan as a standalone plan, or they can do the combination plan, which is what we're doing. So ClearShare is a health share. So for those that aren't familiar with what a health share is, it's a community of people that are pulling their money together. Everybody pays a monthly fee, just like a normal insurance policy would. This is not insurance. This is an insurance alternative. So you pay your monthly fee. That all goes into the community pool. And then you have something called an annual max, which is like a deductible. So there's a $1,000, $2,500, and a $5,000 annual max. And if you have a medical issue that you need urgent care, ER, whatever, you would end up showing your card to the hospital or urgent care. They would contact ClearShare. They would do all the billing information, contacting all of that. ClearShare would end up sending you a bill for your annual max. And everything above the annual max would be taken out of that community pool. The cool thing about ClearShare is that you get $0 telemedicine 24/7, 365 days a year. So you can use that doctor. You'll have a doctor in your phone because you'll have an app, and within 10 to 20 minutes of clicking, I want to see a doctor, you'll have a doctor or a nurse practitioner on the phone with you via call or even video call. They can check you out. You have a rash, you have a cut, you have a kid that got a concussion. They can do a whole concussion protocol. You sprained your knee, you want to get an evaluation. They can do an evaluation over the phone. They can write prescriptions. So that's going to keep you out of the doctor's office and having to pay the copay, having to wait the hours of whatever to get in for an emergency visit or waiting in an urgent care or emergency room. And then if you do have a true emergency, you just end up paying your annual max, which is what you would normally do with a deductible. But the key thing with insurance and a deductible is that just because you pay your deductible does not mean the rest is covered. You usually still have an 80 or 80-20 split where you are still responsible for 20% of whatever that emergency situation is, which is why there's so many people that have medical debt. Is I think there's a stat that says 65% of bankruptcies are due to medical debt, and 90% of those people had insurance. That's
Yeah, I've seen that.
mind blowing. And so people think, oh, insurance, it's government regulated, it's good, I'm safe. But, insurance doesn't mean you're going to get the things paid for. The claims are often denied, right? And so you go through this whole whatever emergency situation only to find out oh yeah, my insurance did pay, but they only paid this much. And now I'm left with this humongous bill. And so this kind of a plan, health sharing, is just, it's flipped. They want you to get the kind of care that you deserve and that you are paying for and that you need. And they don't want to make it prohibitive for people that if they have a medical emergency or medical situation, that they're then stressed out because now they have medical debt.
Yeah, just because we have so many people that listen to the podcast with a chronic illness, there's even people going through cancer. If somebody has a diagnosis that's going to lead them to longer term care, is there a limit to how much the health share will pay out? Is there a time limit for I'm imagining all these different scenarios that come up, which for me, and I've actually been in a health share before. I read the fine print, I looked at the details, and it just made me a little bit nervous, especially given my health history.
Yeah. So if you're on the ClearShare program and you have a pre-existing condition, there is like a 5-year ramp up in terms of how much is covered. So if you don't have, if you haven't required treatment or hospitalization for 12 months, and you get a certain capped amount, and then the longer you go without treatment or hospitalization, then the more amount is covered. And then after 5 years of no treatment, no no hospitalization. Then if you have a reoccurrence, it's seen as a new issue. But the really amazing thing about the holistic plan and the holistic savings plan is there is no pre-existing condition exclusions. And there's no annual max for the holistic plan. So people that have insurance that may have cancer or have those long-term kind of disease issues and they're getting the treatment through their health insurance, keep the health insurance, but add holistic savings or the holistic plan, because now you can start seeing the acupuncturist, the chiropractor, the naturopath, get the IVs and do all those kinds of things and get probably at least half or more of your out-of-pocket costs reimbursed for your visits. So
Yeah.
the holistic plan, we really wanted it to be available for anyone. And so there's no pre-existing condition exclusions, which is really wonderful because so many people, especially your listeners, they're wanting to use those kind of holistic services and, alternative methods of dealing with things. And it's so cost prohibitive for a lot of people. So this is a way that really can just give you some more money back into your pocket so that you can maybe go see the practitioners more often or just be able to live with a little less stress in terms of your budget being so tight because you want to do all these kinds of things, but you can't really afford it. This will let you
Yeah.
afford it.